Hello everyone. Today we are at AadityaCare Center and we are in conversation with Dr. Abhijit Jadhav. Dr. Abhijit Jadhav is a renowned endocrinologist. So over to you, doctor. Please tell us about yourself.
Hello everyone, myself Dr. Abhijit Jadhav, consultant diabetologist and internal medicine person. I did my graduation and post-graduation from BYL Nair Hospital, KEM Medical College, Mumbai. I'm born and brought up in Mumbai. I'm practicing independently last 18 years in Mumbai. I run my own setup at Mulund and Bhandup. So my area of practice is more precisely of diabetes management, thyroid disorders, obesity, metabolic syndromes. And my core interest in patient education and providing proactive and preventive diabetes practice in Mumbai.
So today we will discuss about diabetes, myths regarding the treatment of diabetes, how lifestyle plays a crucial role in having issues regarding diabetes, obesity, and other things. So over to you, doctor. Doctor, please enlighten us. What is diabetes? What are the types of diabetes?
See, diabetes is nowadays a lifestyle disorder. Particularly, it is a raised sugar, abnormal numbers. And how we define diabetes by numbers, by when you see fasting sugar more than 126, or PP sugar more than 200, or HbA1c more than 6.5. Commonly, we see a lifestyle disorder. 95% diabetes are type 2 diabetes, which are they acquire in their second or third decade or fourth decade. But another 2%, 3% we see in children less than 10 years of age. They call as type 1 diabetes. So these are the most commonest diabetes we see. And the third commonest we see in our hospital also, that is because of maternity hospital. So we lot many gestational diabetes. That is diabetes during comes with gestation, during pregnancy. So that is the third type of diabetes.
Okay. So, doctor, can you, for our audience, can you please tell us the difference between type 1, type 2, and type 3 diabetes in detail?
See, the type 1 is purely belong to a genetic disorder which is seen in first decade of life, that is children, and they have defective pancreas. They need maintenance of insulin for the rest of their life.
Okay.
So they don't respond to the tablets and they require to follow diet as well as insulin. So they are the small children and they forever they need that for till their last breath or the age. Type 2, which is particularly initially it was a hereditary disorder, but nowadays we see in last 25 years in India, it is purely lifestyle which has changed and evolved, and that has given us a obesity largely. So what we see in our OPD patient, they are 75% they are obese, overweight. So they are all type 2. That is, they are having good pancreas, but they got insulin resistance and then insulin defect. So that is type 2. So they respond to the tablets, and later part they may need insulin. And third type you said, that is the GDM, where it is purely because the baby is inside the mother's womb. Mother has an insulin resistance and she need to fight with the insulin or a tablet during that phase. But that is again temporary phase. After the delivery is completed and mother is non-diabetic. But she again has a risk of getting diabetes in a lifetime.
So, doctor, we spoke about type 2 diabetes. So, what are the early symptoms? How we can, detect diabetes at an earlier stage?
Commonest sign symptoms patient tell us is they get increased frequency of urination. They pass more urine frequently. Then they feel thirsty also since they are passing urine. And they tend to lose weight also in spite of overeating. So the thing is called polyuria, polydipsia, polyphasia. The three P's. Basically, this is a major triad of detection of diabetes. But since nowadays we see common young people are getting diabetes, and most of us are in AC rooms and cabins, and we don't realize we are thirsty or we are passing more urine. So most of the patients nowadays they are asymptomatic. They don't have symptoms. They are detected accidentally while medical checkup or insurance policy or employment screening. So we don't have those classical symptoms also of those what I just said. So because of young population is getting diabetes much early.
So, doctor, why are we seeing diabetes so much in young patients? That is one. And then आप ये भी बताइए कि लाइफस्टाइल के लिए हम ऐसे क्या लाइफस्टाइल चेंजेस कर सकते हैं so that diabetes हमें ना हो, और अगर हो गया है तो what we can do so that we can reverse the diabetes.
So we discuss about type 2 diabetes, which is largely 95% population is suffering. But again, as I said, younger population is why falling their prey in this category because of the obesity. And nowadays obesity start from the school days. Childhood obesity is the most common. In Mumbai city, almost 18-20% childhood pubertal age group they have a diabetes. So this start from their second decade to third decade, and when they finish their colleges, start job, they get pregnant after the marriage, they get diabetes, and that's why the younger population is falling more in this category. Of course, we do have more than 50% patients who are above 50 years of age, but this younger population is purely falling for lifestyle disorders. And that's why the challenge for them to change the lifestyle and reverse the diabetes, which is quite possible. We do not use word reversal because it's a little gimmick there. Because again they lose their lifestyle, they will again fall for diabetes. So what they need to do is a remission. So if they target 15% weight loss and change the way they eat, the activity increases, the diabetes will vanish and they don't need medicine. So that's the role of reversal in diabetes, particularly younger population.
So we spoke about younger population, we spoke about diabetes reversal. मुझे ये जानना है कि फॉर पेशेंट्स हु आर अबव 50 years of age, फॉर एल्डर्स, can there be, is there a possibility for diabetes reversal? If not, then yeah, like older generation, they also have a question कि जो treatment है, the medicines that they take or the insulin that they take, so is there any side effect of the medicines, is there any side effect of the treatment on them? Please enlighten us with your thoughts
about middle-aged population when they are already diabetic for 10-15 years, and they would require to continue their diabetic drugs, as well as if they need insulin. Now the commonest question is asked by patient to us is side effects. So believe us, the side effects of diabetes is more dangerous and more deadly because it affects all your vital organs, your eyes, your heart, your kidney, your diabetic foot, gangrene happens. So this is more dangerous than taking those pills, and those pills are already time tested. Medical science has given it to you. It's very safe. Does not give you any complication to your heart, your kidney. In fact, nowadays in last 15 years, they have to prove their cardiovascular CV safety data, so that they can be given to every patient. So the medicines which is currently available in India across the globe, they are very safe. So there is no issue with this, particularly senior citizens. In fact, it increases their longevity. They survive 80 years of age, 90 years of age without complications. So there's no worry about insulin or tablets in such population.
सो सर, आपने अभी एल्डरली डायबिटीज के बारे में बताया. यू ऑल्सो स्पोक अबाउट टाइप 3 डायबिटीज विच इज फॉर women who are pregnant or who are expecting a child. So आप उसके बारे में हमें बताइए कि what is it? Is it permanent? Is the diabetes, will it stay throughout their life? So please enlighten us about the diabetes of type 3.
About the pregnancy which you asked question, the pregnancy itself is a hyperinsulinemia, insulin resistance, where the female has a more tendency to put on weight, and during her second trimester she gets abnormal numbers. So that's why it is called gestational diabetes. So she has to look after her diet throughout her pregnancy, and once delivery is done, then baby is out, then mother is non-diabetic, but she has a tendency to put on weight. So she always get a risk of again getting put on weight after lactation period gets over, or in a third decade or fourth decade. So we always want this all young females who are diagnosed with GDM to be careful about their weight and their lifestyle. So that's the one part about the pregnancy with diabetes.
So we spoke about the 3 types of diabetes. What is the role of lifestyle? I want to understand, sir, what is the role of AI and applications that we have, or the sensors that people use, to monitor their diabetes. So what is the role of technology in medical treatment?
See, doctor like us in India, we are already using software for our everyday work. So our digital prescriptions are always there. So patients are using already those apps in their mobiles also, so they can cross-check their prescription, their pathology reports. And young population is more techno-savvy, you know that. So as a doctor or as a physician, what we are using is a software. Then we are using apps which basically tracks the patient records as well. And same time, we use the modern technology like CGM. CGM is continuous glucose monitoring surveillance, where patient applies a sensor over the arms and it detects like sugar every 15 minutes, and it sends across the cloud-based system to us, to our desktop. So we keep on tracking their blood sugar. So what happens here, we able to manage their diet as well as medication, and be able to give customized prescription of medication as well as dietary advices. So that keep them sugar very well controlled. And the risk of hypoglycemia. What is hypoglycemia? Low sugar, where patient often get tendency to have a low sugar because of the insulin, because of tablets, which is again minimized with the help of this technology. And again, the technologies come in the prescription of patient also. The kind of molecule we are using, those molecules were never there 25 years ago. Those molecules are trying to revive your pancreas. They're trying to protect your kidneys. They're trying to remove the fat from the liver. So fatty liver is very common in days. We get the obesity, so we have most of the patients are now with fatty liver disease. So what we need to do is try to make them lose weight. So we have particular advanced molecules which make them lose weight. So that's the advances in the technology in medical science.
So, sir, we spoke about diabetes, across populations. We also spoke about the myths and barriers regarding the treatment. We spoke about the technology. I want to understand what next. What is the future of diabetes in India and across globe? If you could, help us with where we are heading in this topic.
You asked me about the future, but let me tell you the present. Presently, what we are using molecules which basically trying to revive the pancreas, and we have technology like insulin pump, infusion pump, which is a closed loop device where it works like an actual pancreas to the patient. So it relieves much burden on type 1 patient as well as type 2 patient. So that's the current technology. Again, current technology is right now working on a islets and transplantation. How people are doing kidney transplant or a heart transplant or a liver transplant. A similar kind of pancreatic transplant is already there in the pipeline. So every couple of years, we'll be putting a artificial pancreas to the patient abdomen. So that is what current practice, and future is tremendously positive for the diabetic patient. Why? Because of technology evolving so fast, and since people are diagnosed much early age, so they are more proactive and they try to look after themselves. That is much important.
So, thank you so much, doctor, for the wonderful insights that you have shared with us. My last question to you would be, what is your message to the patients and to our community?
See, I'm a primary care physician and a caretaker. So anyway, we deal with the complications and managing sugar. But my job is to make them understand the disease and create more awareness about it. So what is my message to them? Understand about your health first and try to take everything hold in your hand, because once you're aware of everything, then you'll able to take a good decision, not depend on your doctor or your relatives or your family. So understand the disease itself and be proactive. And it is not only the treatment and planning, it is a war kind of situation where we have to win over the war.